Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for having us today.
Well, thank you for having me on the program.
Okay, so let's just jump right into it. Yesterday, you would have spoke about the rising numbers of COVID-19 cases and the fact that regional hospitals were seeing an increase in cases as well. In Region 10 specifically, there has been some resistance to the COVID-19 vaccine. Would you say that this is a contributing factor to the rising numbers?
But no, I think the people in Region 10, if they don't abide by the measures, which is keeping their distance, wearing masks and so forth, of course you will have transmission. And it's not only Region 10, it's in all the regions. If you don't abide by these simple rules, you are going to have transmission. And that's what we are seeing. What vaccination would do is to help to reduce the severity of the disease. And therefore, if people get vaccinated, then we'll see less people getting into the hospital. As you know, we have seen an increase in hospitalization, and to avoid that, we'll want people to get vaccinated. Right now at the Linden Hospital, we have about 5 persons who have been hospitalized. So these persons could have been, if they've received their vaccines, they probably would not have been in hospital.
Okay, so how does the ministry plan on dealing with this matter if it continues along this line?
Well, we are working, we have seen that Region 10 is one of the regions that did not have a high uptake of vaccines. And we are working with different people in the region to see how we can increase that uptake. So it's an ongoing process, and I'm sure once people are convinced of the efficacy of these vaccines, that they'll come forward and get their vaccine.
Okay, Minister. Now, speaking of regions, we know that monitoring is continuous. Are there any regions besides Region 4 that is of particular interest at this time?
Well, Region 4, we've seen the highest number of cases so far, active cases, but we also have a significant amount of active cases in Region 3. We have seen active cases in Region 7. Most of the other regions are pretty stable, but we continue to monitor them and we continue to do testing.
Okay, Minister. Now, you mentioned that the GDF has provided about 400 personnel to assist with the COVID-19 vaccination rollout. Can you tell us in what capacity these officers would be functioning, as well as will they be stretched across the regions?
They would be in every region helping out our teams. Their roles would vary. Those that are from the medical corps would be able to help us with vaccination. Those who have other skill set would probably help us with explaining to the patients or the persons who are coming for vaccines the difference between vaccines, what we are looking for, things like side effects and so forth. I think that's very important. So they'll help us with this education program, and also they would assist us with documenting the information that we need to collect. So that's the role that they would play, and we are happy that the GDF has allowed us to get access to these personnel, because they would certainly enhance the accelerated rollout that we have.
Okay, Minister. No, thank you for that. Now, before we go, I want to take you a little bit to vaccine mythbusters. I have one. Many persons believe that they're not at risk for severe complications of COVID-19, and so they do not need the vaccine. Can you share your views with regards to this myth?
Well, vaccines, first of all, are safe, they're effective. In this instance, these vaccines that are available help to prevent severe form of the disease. We have seen that a number of persons have been hospitalized in Guyana, and those hospitalizations could have been avoided if people were fully vaccinated. We've also had a number of deaths in Guyana, and if you had been vaccinated, fully vaccinated, some of those deaths would have been prevented. So it's important that people get their vaccine because it's actually going to protect you from getting the most severe form of the disease, prevent you from going into hospital, and prevent you from dying.
Okay, Minister, thank you for that and thank you for your time today. This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy or our social media platforms.